issued a 21-day strike notice that was to expire on 23rd of December 2024. And it's coming upon on the backbone of the issues that we had signed in the Return to Work Formula of 8th May 2024. We had declared, based on our union's resolution in the Special Delegate Conference, that we are not going to take any more promises in this particular strike notice that we issued. We want to appreciate the involvement of the Deputy President, the Council of Governors, and the Ministry of Health that have worked around the time to ensure that what we demanded, that is the evidence that the doctors in the counties are receiving the basic salary arrears, for us to sit here today. Today we have seen an evidence that doctors, like from Kwale County, have begun to receiving them to get their money because these are already been sent to the bank. We also discussed the issue of medical doctor interns that has been a thorn in the flesh for quite a while now. I must appreciate that we have an agreement, and the collective bargaining agreement signed in 2017 to 2021 has not been bastardized, but has been protected and sanctified. And in today's agreement, the interns doctors can actually check their pay slips tomorrow on Saturday, and they'll see the confirmations that they'll be getting their full salaries. This is an appreciation and a commitment that we've seen today, and we believe that we don't always have to progress on industrial actions before issues are resolved, and that's why we appreciate the commitment. And I want to advise our doctors all across the counties to start checking their pay slips, checking the banks, because this has been paid through a voucher system on these particular monies. Otherwise, we appreciate the commitment, and we believe that when you work together with government, when you work together with our employers, we will always have these issues resolved, and discussion continues far beyond the industrial action time.
Your Excellency, I'm very happy to announce here in your presence that between ourselves as COG, the National Ministry of Health, and KPMDU, we have resolved the issues that had resulted in KPMDU issuing a strike notice. The Secretary General has suspended that strike notice so that Kenyan doctors can continue working in our public hospitals during this very critical time. We want to assure KPMDU that the remaining parts of any agreement, including the adjustments that we said will push to 2025-26, will be adhered to, will be achieved, and that we will, as COG, do our best to avoid another industrial action that puts our health sector into disarray. So I want to thank you, Your Excellency, for your leadership in this matter, and Kenyans can then look forward to a Christmas where our doctors will be in the hospitals serving Kenyans. Thank you.
Thank you very much, and thank you, Your Excellency, for again guiding and leading the process of negotiation. We are happy to report that the strike has been called off. And again, we are continuing to engage the human resource for health, which is really a critical pillar when it comes to implementation of Taifa Care. So we'll continue engaging with various healthcare workers, including KMPDU, to ensure that we are offering best quality, affordable, accessible services to Kenya.
And thank you for coming. We are very pleased to announce to the nation that the strike, which had been called by the Kenya Medical Practitioners, Pharmacists and Dentists Union, has been called off as a result of very, very intense negotiations that have been carried out in the last few days behind the scenes, in the spirit of confidence building and utmost good faith. In that vein, I would like to thank the union. I want to thank the Council of Governors, and I also want to thank the Ministry of Health for facing this matter patriotically and in the interest of the country. And therefore, even as the country goes into the festive season, we are glad that we can now sigh with relief that our hospitals, our public hospitals will be operating, because our doctors are going to continue providing health services, which is their calling. I want to reiterate the commitment of the government of Kenya and President Ruto's administration commitment that healthcare is a critical sector that this government takes seriously. It is in this connection of prioritization that we are rolling out Taifa Care, which is aimed at providing medical insurance for every Kenyan.